Let's keep it going in the KUAM News Zoom room. We're putting on our public health hat now. We have the Chief Public Health Officer for the island of Guam from the Department of Public Health Social Services, Chima Mbakwem. Good morning, Chima. Unmute.
Good morning, Jason. Good morning, Chris and Sabrina.
Good morning.
All right, let's just start with these 23 cases. Were they vaccinated, unvaccinated? Were 23 cases? That's a lot.
Cases from yesterday. I'm still trying to get the AP information from the team, so I didn't get it before the interview. But I can get back. I can get that back to you. Yeah, but mostly they send me the reports early morning, but I didn't get it on time this morning, so I can't discuss the details of the case.
What about any new results from samples sent to the CDC for genomic sequencing? Have we gotten anything?
We've not gotten any result back. We send bi-weekly to CDC, and we're not the only state or territory that is sending. So, but we expect to hear from them soon. But we keep sending results that meet the requirement.
There's been lots of talk about the Delta variant, and it's been a while since I've seen the release with the latest samples sent to CDC. But I want to say that I did see on one of them that there was a confirmation of the Delta variant on Guam. And so I guess maybe just any concerns that you may have and you'd like to share with the community, because we did have Dr. Hoa on yesterday, and he's encouraging, and begging basically parents to go get their children, if they're eligible, to get vaccinated. And also the Physicians Advisory Group is discussing the possibility of mandating that GDOE teachers, staff, be vaccinated.
Yeah, so for the Delta variant, at least everybody understands how highly transmissible the Delta variant is. But listening to the WHO chief yesterday, there is grave concern all over the world, because as at yesterday, 4 million new cases were actually reported. 4 million. And there's an expectation of this to surpass 200 million in the next 2 weeks. And in 5 of the WHO has 6 regions. 5 out of these regions have an increased rate of transmission up to 80%. And just in Africa, there's an 80% increase in deaths. And all this is attributed to the highly transmissible Delta variant. And all this can be attributed to increased social interaction and travel, inconsistent use of public health and social measures, and lack of vaccination. So Guam is in a very good place, because WHO's expectation is that 10% of every country should be vaccinated by the September of this year. Guam has surpassed that. They are looking at 40% by December and basically 70% by summer of next year. We've actually superseded all these expectations, but we need to be very aware that without surveillance testing, without adhering to public health measures, without vaccination, we are at the same risk with every other person in the world. So we just need to put that in the front burner. We are doing well right now. We don't have to lose our guards. We need to continue vaccination. People need to continue wearing their mask as stipulated. Even when people are together, it is still advised that people should wear their mask. So this way, we'll continue to enjoy the benefits of where we are today. Because if we do not continue vaccination And with what the Delta variant has been able to show us, it's still going to be that pandemic or epidemic of the unvaccinated. We've had some breakthrough cases, so it is also, we should also be aware that notwithstanding that you're vaccinated, you also need to continue to protect yourself. It is just another layer of protection, but it stops hospitalization, it stops you from getting very sick when you get exposed. So looking at all these factors that I mentioned, one is in a very solid place, but maintaining that is what is crucial moving forward.
Well, Chima, how can you say we're in a solid place when, like you said, we're seeing 4 million new cases? We're also hearing national reports about the effectiveness of the vaccine in people who took it a while ago. I mean, I was one of those people that took it way back. So we have that, and then we've got travel coming into the island. All you need is a negative test, but we know just from experience that sometimes a negative test doesn't even mean anything.
Yes.
So I mean, I get it that you're kind of up there in public health and you don't want to cause any unease out here in the public, but I mean, every media report we're reading is basically raising the alarm about this. And we had Dr. Ho on yesterday, and he was, equally concerned about the Delta variant and the school kids. So it's just interesting to me that we're reopened. There's no restrictions and stuff, but it just seems like we're not maybe as in as good a position as we could be.
So it is trust. Trust is the key word. Trusting public health, adhering to public health recommendation, vaccination. Because right now, if you look at the data that I just presented to you, if you're comparing what is happening outside and what is happening inside, you can see there's a great difference. And we've been able to achieve this based on the trust, based on compliance by the community. So while we are opening up, you should also look at the fact that we also put our recommendations out there. And now these recommendations are layered. While we are taking out community quarantine, while we are reducing restriction for social mixing, at the same time we're saying wear your mask, get vaccinated, wash your hands. So you look at all this layered approach. If you follow this layered approach, you find out that we'll still be in a good place. One cannot supersede the other. All should go at the same time. So with our increased vaccination rates, we're in a good place, because even if you get exposed, people are not going to get too sick and get hospitalized. If for any reason you are not vaccinated, and we encourage you to get vaccinated, when you are infected, the number of people you are going to infect will be lower if everybody is wearing their mask and washing their hands. So it is a behavioral change situation now. People would have to start looking at this, from how they live their lives. The COVID is here. If you don't get vaccinated, there's more chance of people being infected, and more infection means more variants. Because when more people are infected, it gives the virus a chance to mutate. So you're going to see, let's put it in this way. Imagine having the Delta variant and also having the South African variant, at the same time. Definitely is going to mutate into something else if both of them affect the same person. So we also have to just look at it from that perspective. Like what I sent to you, Chris, this morning. I know if you look at it, you're going to look at the fact that Guam was at 0 yesterday.
Yeah.
But today we're discussing these new 13 cases. But for us on the public health side, we now look at this, like I said, they're actually preparing the report for leadership, because we sit down and try to identify where these cases are coming from, what is causing these cases, so that we can move in and take care of it as quickly as we can. But if we're finding out, like we reported the last time, that we are seeing a lot of unvaccinated people who are being exposed to who are being infected, we've been increasingly asking the public to come out for vaccination. We have gotten to our 80% vaccination target, but at the same time, the department is still going on with setting up village pods. We are working with the mayors and the GONG to continue vaccination. We are opening up our central clinics. We are working in conjunction with private clinics, to continue vaccination. We want to achieve 100% vaccination. We want everybody vaccinated who can be vaccinated. We want to protect those who cannot be vaccinated. But at the same time, we need to keep an eye on those who are not vaccinated by doing the screening testing to see if there is ongoing transmission within these people, or even with the vaccinated population, if they are still being infected and they don't have symptoms. So it is a balance. So the screening testing component in that layered approach is what public health is also promoting, because we can't sit back and say, yes, we're in a good place, everybody is vaccinated. We have a group of people that are unvaccinated. We have a group of people that are vaccine ineligible. So what are we going to do? Sit back, let these people not get screened. So I think it is a hard balance, because we need to continuously be vigilant to make sure that if there is any case, then we can move in and try to mitigate right away, so that we can still be in the safe place that we are today.
Bree?
Yeah, so just for parents that are going to be sending their children to school in a couple of weeks, I guess your advice to them.
Okay, we just brought out an interim guidance for school reopening. Right now, when I jump off this call, I'm actually jumping on another meeting with DOE. We have a meeting with the PAC group tonight. We're looking at the best way, to keep the community safe. It's something that we need to do consistently. Like I said, we're in a safe place, but we need to continue being safe. So continuing being safe is continuing to be proactive. We don't want to be reactive, and that is one thing the director has always drummed into our ears, the fact that we should not be reactive. It is our responsibility to be proactive. We have the capacity to be proactive. We have the surveillance report. We have all these mechanisms in place in public health to think ahead. And we've been able to see, the commitment from our partners, and our other, and the community, in relying on public health guidance to get us where we are today. So I think we've actually gained that trust with the community. At the beginning, it was difficult, trying to understand why those interventions were in place. So as the schools are reopening, public health has actually put out a layered approach on how the schools will remain safe. Our intentions are clear. We don't want whatever interventions that we have in place to keep kids out of school. We want everybody to be in school. But also remember that it is the responsibility of the schools right now to adhere to the public health recommendations. Because if you do not adhere to the public health recommendations, the liability of, things going wrong is on you. If the kids in your schools are the ones who are going to get sick, the kids in your school are the ones that you need to protect. So it's also looking at it from the perspective of public health, working very hard, with the data we have and with the contributions of our partners and our federal partners, to come up with this robust process, to keep our community safe. And also expecting the same from these schools, expecting the same from the community to adhere to what we're saying so that everybody will be safe. So as the schools are reopening, we have this guidance out there. We believe and we trust that these guidances will be followed to the letters, and then we will not have any increased reason to worry about what is going to happen. So that would be my own contribution, to what we are recommending. Trust public health, do what you're asked to do, and we'll continue to be in a safe place as the schools reopen.
All right. Just real quickly, so do you support what the PAG was discussing on our show yesterday about mandating that GDOE employees be vaccinated?
Can you repeat? I didn't get it.
Do you support the Physicians Advisory Group recommendation to have GDOE employees fully vaccinated?
Yeah, I personally will support any initiative that will keep the island safe. But we also have to look at the legalities, the receptiveness of the community. So it's a good proposal, but for you to mandate people to do things, you really need to put into consideration a lot, So I think that is what is being discussed. For you to mandate, you need to make sure that what you're mandating is okay, is acceptable, and like I mentioned in my last interview with the team here, that discussion is on the table, and it can be just my decision or the department's decision. We actually work with partners. We work with the AG's office. So we're still sitting back. So the recommendation of the PAG is in a good standing, because everybody being vaccinated is going to be beneficial to the community. So either mandated, either personal, either we beg, by whatever means necessary, for us to make the community, reach 100% vaccination is what we really are looking up to. So I believe it's a discussion that is ongoing, and if it's adopted, then we will support it.
All right, thanks, Chima. Always appreciate your time.
All right, thank you so much.
Okay, take care.
Thank you.
All right, we're going to take a quick break, and we're back with more of The Link next. Good morning.
Learn more about our region on the One.
We're on a mission to fill the bus with necessary school supplies